As the NYPD battles gang warfare in the city, a nonprofit in Brooklyn is fighting to keep young people safe at home, in school, and on the streets. Experts say gun violence is the leading cause of death among those 15 to 24, and low-income communities of color are most at risk.
And joining us now are Ramik, Jamar Williams, and Keith White from CAVI. That's an intervention program that provides services to communities impacted by gang violence. Thank you guys so much for being here.
Thank you.
Now, I'm going to start with you, Ramik, because CAVI stands for the Kings Against Violence Initiative, and it was founded by a doctor who was experiencing gang violence on a regular basis. Normally, people would just be like, I'm moving out. I'm moving away from this. He stayed and he founded this.
Right.
Why is that?
Well, he's a Brooklynite, born and raised in Brooklyn, and he comes from a history of community activism within his family.
I see. So that obviously he wanted to make sure he was giving back.
Absolutely.
You know, it's so sobering, that intro, the leading cause of death, 15 to 24. I mean, it just boggles the mind that that's still the deal. You know, talk about the community roots for it and the way out of it. It's such an intractable problem, it seems.
Yeah.
So I think that we look at the problem as a systemic and institutional problem, and so the goal is to build systems and institutions to combat it. And so doing that, and so, you know, again, giving salute to Dr. Rob Gore, the founder of CAVI, who understood that violence is a public health issue. It's not just people being angry for no reason. These things are not happening in a vacuum.
Right.
Yeah.
Keith, where does that, how do you even address it from the very beginning? Where's first place you're like, we're going to start here?
So that's a good question. It's tough, and I think that you have to have people on the ground dealing with the traumas that are the result of violence, right? But then you have to have preventative work being done. And so that's some of the important work that Ramik is doing with CAVI. Is they're doing mentoring. We're in schools, and so we're trying to get to the spaces before the competition gets there. And the competition is violence, insecurities, poverty, hunger. And so malnourished kids who aren't getting mental health help, and who aren't getting adequate education are being left to fend for themselves.
You mentioned something there. He said before the competition gets to them. How young is the competition getting to these kids?
We've seen participants with violence-induced injuries as young as 12 years old. And I think it helps to know that between 2009 and 2020, violence for young people was actually trending down. But once the pandemic hit, those risk factors that lead to violence were exposed. And so the number of protective factors that eliminate violence were decreased. So things like after-school programs, in-school programs, access to libraries and community spaces. Without those things, young people really didn't have a place to go. And so when we ask the question, how do we get out of it, we reduce the risk factors and increase the protective factors.
Right. I guess, like, on the flip side, you saw the things that worked when they were taken away and how valuable they were, right?
That's absolutely right.
Yeah, and, you know, it's interesting. Obviously, you know, it's a common phrase used in therapy and whatnot, but hurt people, so the victims one day become the perpetrators the next, and that's where you have to get involved.
That's right. So when retaliation becomes a factor, and so for our hospital-based program, the number one thing that we look at is recidivism. So people returning into the hospital with a violence-induced injury. And so when we think about retaliation, we think about it in terms of how can we interject and intervene and engage young people, and really all people that come into our programs, to think about their next step, their next lives, activating new behaviors, utilizing social workers and social work practices. We have a program called Self, Safety, Emotion, Loss, and Future that really gets young people to think about activating a different type of community, a different type of ecosystem for themselves, so that they're no longer prone to violence or becoming victims of violence again.
Keith, before we go, could you tell us maybe a story of maybe a kid that has turned their life around because of CAVI?
So I can tell you multiple stories, but I don't want to, I don't want to violate anybody's, rights to privacy. But I will tell you that there are many people that are on the staff of CAVI at this point, right, who have come through, who have been the victims of a crime, or have been the perpetrators of a crime, and who have, through some transformational work from Dr. Gore, Ramik, Anthony, and other intervention people at the organization, have turned their lives around. And so there are multiple stories like that.
Yeah, it's hard to think of much more valuable work than what you guys are doing, so we wish you the best of luck. Thanks so much for coming in.
Thank you.